All very. All right, I'm just double checking one more thing. Awesome. All right, we're 1 minute past 7:30. And like I said, I want to be cognizant of everybody's time today. I know you all are busy and it's first thing in the morning. So people might join as we have this conversation, but it is being recorded and you will receive the slide deck. So I'll go over some housekeeping things in just a minute, but I would love for my friend and partner in crime here, Sam, to just do a quick welcome for everybody. Go ahead, Sam.
Yeah, hi everyone. Thank you so much for joining us on your morning hour, beautiful morning hour actually. So to discuss ways to prevent, to discuss ways to decrease preventable stillbirth in our community. Excuse me, goodness, 7 in the morning.
Morning, it's morning.
Yes, my name is Samantha Kinning, and I'm the Perinatal Quality Improvement Coordinator at Bryan Medical Center in Lincoln, Nebraska. Today, we are highlighting this very important topic to align evidence-based stillborn prevention practices between the clinics and hospitals. So, after observing and evaluating the varying ways patients are receiving education, we knew it was time to take a step back and advocate for the best fetal movement practices with a simple and proven practice with Megan. So not only are we here protecting to work we're here to protect babies in utero. This prevention practice also benefits moms. According to the NIH, women who have stillbirths are at a substantially higher risk for severe maternal morbidity than women who have live births. So, regardless of the cause of fetal death, if you could take a big part, if you could help play a big part in a family's taking a healthy baby home with a healthy mom, would you? So, please help me welcome Megan and Shannon from Count the Kicks.
Thanks, Sam. That was a great opening and just really set the stage for what we're going to talk about today. And I think as nurses and providers, you understand the toll a stillbirth has on your team, yourself, emotional toll, physical toll, and of course on the mom and the family. So we'll go into that in just a little bit more. Just some quick housekeeping background information too. Just huge shout out to Sam and Marissa and the team there at Bryan. I've known them for a couple years. I've been with the organization Healthy Birthday, which is the nonprofit organization that created Count the Kicks, for about 5 years. And my background is in public health. And so I love what I do. I love having these conversations every single day I work 50 some hours a week, probably nothing compared to you all, but it's just because I'm so passionate about it. I love it. I love it. I love it. I love giving you the tools and resources. And then I love learning from you. What's working, what's not working, what questions do you have? So I think one thing that would really help me as I have this conversation with you today is to just, if you wouldn't mind putting in the chat where you work, and then are you a labor and delivery nurse? Do you work in triage most of the time? Do you work in more of a clinic setting? I'm based in Iowa, so not too far away from you, but this will just give me the lay of the land of where you're at in Nebraska and kind of what you're encountering. Are you mainly rural areas, a family care clinic that way, or are you all labor and delivery at the health systems there? I just want to know that. So feel free to put that in the chat if you're comfortable doing that, or just send it directly to me. So thanks, Sam. Shannon is one of our Count the Kicks ambassadors. You'll hear her story a little bit later on. She couldn't join us this morning. She works at a health system, doing, oh gosh, like the children's specialist at the hospital. I can't recall the name of the title of what those individuals. She's amazing. So she does that in Omaha. So she couldn't get away today, but our contact information's on the screen. She can come do in-person things as long as it works with her schedule. She's a trained volunteer. And then of course my contact information's on the screen too. And again, you will get this recording as well as a PowerPoint slide deck afterwards. And we'll talk about how to access those CE trainings here towards the end as well. So disclosures, I have no disclosures to report. I did want to add this disclaimer. I know what you all see day in and day out. Well, actually, I don't. I'm not a nurse, but I'm sure you see a lot of different things that are emotionally draining. Today, obviously, we're talking about a very emotional topic, stillbirth, as well as maternal mortality and morbidity. So I really wanted to acknowledge the sensitivity of this topic and the potential emotional impact it may have on some individuals. I really encourage you to prioritize your emotional well-being. It is entirely okay to step away from the conversation. I do have some images that have been we've been told we can use, and so I just wanted to kind of level set with that. So before we dive right in. And then the objectives today, I hope that you will be able to have a good understanding of fetal death or stillbirth nationally and in Nebraska, and what the cause is and how it impacts everybody, maternal mortality, morbidity, et cetera. And then, of course, I want you to walk away with the tools and resources in your toolbox to say, I know how to implement this. It's more than just saying, have you felt your baby move? Or tell me about your baby's movements. We're going to really talk about the implementation aspect of it based on where you're at. So that's why I asked for the chat. So it's interesting to see where you're all coming from today. So we have NICU, we have some urban, mom, baby at Bryan. So that's great, really helpful for me. So I hope you all know that stillbirth is really well, it's a tragedy, but it's also not talked about, right? We lose around 21,000 babies every year in the United States to stillbirth. That's a crazy number. That's about 65 babies a day. We would be talking about that if that was, a busload of children or something like that. And we're not talking about it. So really, let's have these conversations with our patients. You talk to your patients about all sorts of things during pregnancy. Stillbirth is another thing that you should be talking to them about, especially ways to prevent preventable stillbirth. I know not all stillbirths can be prevented, but we have tools to help patients feel empowered and ready to talk and share about their fetal movement that can potentially save their life and their baby's life. So 1 in 175 pregnancies ends in stillbirths in the United States. The racial disparities exist and persist are just so devastating. Native Hawaiian or other Pacific Islanders pregnancies, 1 in 101. Black pregnancies, 1 in 101, and then American Indian or Alaska Native, 1 in 133. So looking at this chart here, thinking about who you serve, who's being impacted the most in your area. This doesn't even go into the rurality aspect, birthing center closures, things like that, and having people to drive miles away from a birthing center to have to deliver their baby. So I'm sure if we looked at the socioeconomic status too, that would be high. In Nebraska specifically, you unfortunately lose around 119 babies a year on average. Your stillbirth rate is 4.74 deaths per 1,000 live births. Based on our evidence and what we've done in Iowa with a 32% reduction in the stillbirth rate, which I'll talk about in a minute, we really truly believe that we can save potentially around 38 babies from stillbirth every year in Nebraska. And really even one baby is cause for celebration, right? So that's what our founders wanted. They said, we want to create this program, and if our goal is just to save one baby, we will be happy. And so I want you to think through that when we're having this conversation, that this is something easy to implement, easy to integrate, and can save lives. So kind of what Sam had said earlier around the maternal mortality and morbidity aspect, I wanted to highlight just a couple facts around that. We know, and research shows, that stillbirth is a significant contributor to severe maternal morbidity. I'll talk about Shannon and Sean here in a minute. We also know that stillbirth was associated with increased rates of SMM starting at 31 weeks gestation and non-transfusion SMM starting at 30 weeks gestation. So these results indicated an increased risk of SMM among patients with stillbirth. And so you can read more of that and the citations there as well. But Shannon, who's your Nebraska ambassador, lost her son, Alfie, was born in 2012. She had some I think she had some blood loss and things like that, where they almost lost her life. And then Sean is our Arizona ambassador, and she lost her son, Zach, in 2010. And I have Sean's story here that I'd like to read out loud with her permission. So she says, "The beautiful boy in the picture here is my son, Zach, who was stillborn at full term in 2010. Throughout my pregnancy with Zach, I raised numerous concerns that were consistently dismissed. 2 days before my son's death, I reported to my provider that he wasn't moving as much. Despite this, I was assured that everything was okay and that he was simply settling down for birth. On July 3rd, 2010, Zach was stillborn due to complete hidden placental abruption. I lost 3 times my blood volume and went into disseminated intravascular coagulation, which led to multiple organ dysfunction. The picture here is the first time I held Zach in the ICU after coming out of surgery and my family being told that I had less than 20% chance of survival. Around 14 years ago, this time I was planning Zach's nursery and I should be planning an upcoming 14th birthday. He had his birthday in July. There will never be birthdays to celebrate with Zach and milestones like driving a car, graduating high school, or witnessing him start a family. I'm sharing my story with you today because while there's been progress in raising awareness in stillbirth, we really must continue to amplify our voices if we truly want to tackle this crisis and prevent future generations from enduring such a profound loss. We also know that you're 4 to 5 times more likely to die if you have a stillbirth as well. So there's really that connection between stillbirth and severe maternal mortality and morbidity. And then I don't think I need to spend too much time on this slide. I think we all know the impacts of stillbirth, both physical and psychological complications. We just talked about some of that with SMM, but we also know there's prolonged and complex grief, the economic burden. Just there's so far, and Sean and Shannon speak about this all the time about the therapy that they've gone through and continue to go through, and how it impacts them forever. I mean, it doesn't go away. From a nursing perspective, I'm sure at some point in your career, you have witnessed this tragedy and the impact it can have. I don't need to belabor this, for lack of a better term, too much on this, but I really wanted to share my friend Kim here. She is with the Iowa Department of Health and Human Services now, but she used to be labor and delivery nurse in Iowa. And she is an amazing human. And she was really one of the ones that helped start Count the Kicks in Iowa. Our founders went to her first and said, hey, we want to do this. Can you help with some funding? And so she helped with that. She now works for the state, but doing birth defect, and she talks to hospitals all the time, and she does all the tracking of stillbirths that come in, and she'll follow up with the hospitals and say, like, it says here that this happened X, Y, and Z. Did you talk about Count the Kicks? Did you talk about fetal movement monitoring? The patient said this. So she'll do that follow-up too and educate them on Count the Kicks. So I wanted to share her story because I think a lot of you could probably relate to it.
Before I came to work at the health department, I was a labor and delivery nurse at one of the larger hospitals here in Iowa. So I know firsthand the impact that a stillbirth has on families as well as the providers. And I have also seen the situations where the woman has monitored her baby's fetal movements and has come in because she's noticed a decrease in those movements and that baby has been saved. So I know that it works, and I know that Count the Kicks make a difference in saving the lives of babies. I think anyone that takes care of a pregnant woman should be teaching her about how to monitor her baby's fetal movements. There was one time when a family had a stillbirth delivery, and as I was dressing that baby after it was born, I realized that that little boy was never going to ride a bike, and that that little boy was never going to go to school, and that the parents would never be able to watch their son graduate from school. And even though you try to be professional and a little bit detached just to make it through your day, you can't help but be affected and know how important it is to prevent these stillbirths from happening.
So like I said, I think a lot of you probably can relate to that story, just like Kim's. And I feel for you. I really do. I know just how devastating this tragedy is. So I want to switch gears a little bit and kind of give you some background on, excuse me, the history of fetal movement counting, just so you kind of have that in your mind as we go through this, because I know you all talk about this. I know you all talk about, is your baby moving? And I know you have these conversations with your parents and patients. What I want to do is make sure that we're having the evidence base, updated conversations that we should be having, because some of this that you might have learned in nursing school is now outdated, and there's more and more research coming out that supports fetal movement monitoring and tracking your baby's movements and speaking up if you have a concern. So talking about just some of the history, and I know these slides are pretty wordy, so don't feel like you need to like memorize them. Like I said, I'll send this out. Well, ACOG first hypothesized that much of stillbirth occurs due to placental insufficiency. And we know that due to the acute or chronic fetal hypoxemia, I'm probably not pronouncing that right. Sorry, nurses. Associated with the placental insufficiency, fetal movements may decrease as the fetus slows to conserve their energy. So we talk about that a lot. We talk about decreased fetal movement, but we're also going to talk a little bit more about an almost frantic increased violent movement that can also be a sign. So just keep that in the back of your mind as we have this discussion. And then there's a study referenced here as well that talks about how many people experience decreased fetal movement and the preceding 2 weeks before their stillbirth for that. And then we also have, again, I know this is super busy and probably hard to see, so I apologize, but really, like I said, you guys have been doing this for a long time. Fetal movement counting was started back in 1970s and 80s where we were having this, but with the issue that we're trying to solve, and we need your help, is the standardization of it, right? I know you all like standards. I know you all like protocols and algorithms and things like that. So that's what we're trying to do with Count the Kicks and fetal movement monitoring. We have the Sadowski method. That's the assess the number of movements the baby has made over a period of time. Think 10 and 2, and then you have the Cardiff count to 10 method, assess the amount of time it takes to perceive 10 movements. So Count the Kicks is a little bit more based off the Cardiff count to 10 method than the other method. And so the other method is more like your 10 and 2. And I'm going to talk a little bit later on about why we don't want to say, make sure you get 10 movements in 2 hours, or have you felt baby move this hour, and giving that time limit predetermined to the patient. I'm going to talk about why that is in just a little bit. And then we also know public health programs and campaigns work. Look at the Back to Sleep campaign. When that was first initiated, I think now we've had SIDS deaths decrease around 50% since the initiation of the Back to Sleep campaign. We know this can be prevented. We talked about the public health crisis, how it's a tragedy, but we know that public health campaigns around stillbirth prevention have worked in other countries. We know the United States is far behind in this, well, in health system work in general, in the medical community, but really in stillbirth prevention too, compared to the UK, the Netherlands, and Australia. They all have these amazing bundles. They all have, put tons and tons of funding their government does into this work. And so that's why we want to try and replicate some of that, but then really do what we know is working. And that's what Count the Kicks is. Count the Kicks is a highly effective evidence-based stillbirth prevention program. We really developed that proven early warning system for moms. We have the tools and resources to make this conversation easier for your patients. Currently, we've saved lives in 36 states and 5 countries so far. And what that is we talk about our baby saves quite a bit, or our testimonials. People have contacted us and said, I was using Count the Kicks. I learned about it from a nurse, or I saw it in my hospital waiting room. I downloaded the app, or I used a paper kit counting chart. I knew it was normal for my baby. Something was wrong. I spoke up because their movements had changed, and now my baby's here because of it. And a lot of times I'm here because of it too, because it saved mom's life as well. So before we kind of get into the implementation of it, I do want to give you some of the evidence behind it and address maybe some questions you might have around that. So feel free to drop those in the Q&A or the chat box. I'm happy to answer questions as we go along or at the end. So the evidence behind Count the Kicks is actually from a Norway study that took place, that our founders, who are 5 Central Iowa women who all experienced stillbirth or infant loss in the early 2000s. They got together through friends and pastors. And, if you've heard this story before, they didn't know each other at the time. they started grieving together and having these conversations and said, this is crazy. Like, here we all sit with relatively similar stories, yet nobody's talking about this. Nobody's telling us, that this is more common than people think. In fact, some of them were told it was like getting struck by lightning. It's like a chance of winning the lottery. And I'm like, who would say that? Like, that would be a terrible thing to say to somebody that lost a baby. So long story short, the founders were at a public health conference where they heard about this research out of Norway that showed when patients were educated, they were handed a pamphlet at 28 weeks to say, count your baby's movements, speak up if you notice a change, and come in and we'll get you checked out. In this study, there was a 30% decrease in the stillbirth rate among this cohort. So our founders said, wow, that's amazing. Great thing start in Iowa. Let's do this. Let's create this public health program and this empowering, bright, colorful program that can help prevent preventable stillbirths. And that's what they did back in 2008, 2009. They created Count the Kicks and then Healthy Birthdays. So I talk about Count the Kicks, like that's our program, but we're technically Healthy Birthdays, our nonprofit organization, and Count the Kicks is our main tool resource program that we implement. Some additional evidence that I want to highlight, we were featured in BJOG and AJOG, the British Journal of Obstetrics Gynecology, as well as the American Journal. You can scan these QR codes when you get the PowerPoint deck, and you can also read them if you really like reading research articles. But the BJOG study really talks about how Iowa has had this 32% reduction in a 10-year time span when surrounding states that didn't have, I don't think Nebraska was included, it was Missouri, Minnesota, maybe Illinois, when surrounding states at the same time saw an increase. In fact, Minnesota has gone up significantly while Iowa has decreased. And then the AJOG study talks about just our app users and the percent of how people feel less anxious and how it helps increase bonding. So it's also on our evidence page on our website as well. This is just a graph, a visual representation of the BJOG study, basically showing our 32% reduction. This should have been updated. I do have 2023 numbers, which is lower than 2022, which is super exciting. So what we're really paying attention to is that dash line, that downward trend, right? We know there's outliers out there. Things like a syphilis outbreak can significantly increase stillbirth. Pandemics can increase stillbirth. So there's some things outside of our control, but our hope is that this continues to go down. Our hope is that it continues to go down in Nebraska. You've had a decrease as well. We partner with the Nebraska Perinatal Care Collaborative there, who funds the materials for free. So we'll talk about that in a little bit as well. Some additional evidence behind fetal movement. I'm sure a lot of you are hopefully AWAN nurses. If not, I'm sure Sam can talk to you about how to be a member. I love AWAN. I love nurses. I always say, like, why didn't I be a labor and delivery nurse? Why didn't I think through that when I was doing it? And now I don't want to go back to school for it. So hats off to you all. I love what you do. I have been working with the National AWAN program on a project, a research study pilot, if you will, on a pathway on what to do when somebody comes in with reduced fetal movement, for lack of better terms. So we're in the final stages of evaluating that data, and there will be a journal article coming out about that pathway as well as the pathway itself. So be on the lookout for that. But what they did release earlier this year was this practice brief on decreased fetal movement. And what this really does is highlights exactly what we're already educating you on. We're just putting it in more standardized implementation pieces versus just a practice brief. But I want you to read this because it's really, really key. And I think it's going to help you wrap your mind around how we should be educating our patients. And it's backed by AWAN. So I wanted to highlight that one. And then most recently, I co-authored an article that was published in the Maternal Child Nursing Journal about standardization. So after this webinar, go read this journal, and it walks through kind of the steps that we're doing today, and just dives in a journal format, essentially. So go check that out. That's also been published. And then I get this question quite a bit. Well, ACOG doesn't recommend Count the Kicks, and I think the most one is there's a reaffirmed statement that came out from ACOG. I just got an email about this not too long ago. And if you look at the reaffirmed statement, it really does talk about the importance of fetal movement. It talks about how we should educate patients, how we should trust the patient, how we should address concerns in a systemic way, how we should use the shared decision making to employ interventions. So this statement that's reaffirmed also is in line with what Count the Kicks is. Will ACOG ever come out and say, yes, implement Count the Kicks? Probably not. Like, it's just like they won't come out and say, yes, use only this sort of Doppler machine. I'm assuming they don't do that, right? Like, they don't promote like any sort of certain organization over the other type of thing. So even though we're a nonprofit, but I want to highlight this because I think this is a sticky point for some folks. And I understand that you have concerns around what they might say, but I want you to understand what they're saying is exactly what we're doing. So I don't think that there's any conflict there. In fact, I think it enhances what we're already doing. And additional research outside of all that I just shared shows that there's no increase in hospital utilization. That's another concern I get a lot from these presentations is, oh my gosh, is this just going to increase calls to my nurses and to my triage? And my first line of thought is, well, that's your job to serve those people. My second thought is no, because what you're doing is you're empowering your patient to know exactly when to come in, exactly when to call versus coming in all the time because they're not sure. So I think you might have a term for that when people come in all the time into triage and things like that. It's probably not PC, but that's what I've heard. So I don't know. But this is educating your patients so they know when exactly to come in and they have data behind it. So no, this does not increase tons of people coming into your triage, tons of calls to your nurses. And if you have true concerns about that, let's talk because we gotta address some other things here that around that. And then the other question I get a lot, especially lately, is and I think it's a valid question because I think what I'm seeing across the United States is this huge movement towards let's focus on mental health. Yay, like we should be focusing on mental health. Absolutely. We do a lot on our app around that. We have social drivers of health. We connect people to resources. And so I get why people might be concerned about, will this just increase anxiety? That AJOG study I talked about earlier, that published paper, we found through research, 84% of app users stated that regular tracking was associated with feelings of bonding, and 77% of app users reported feeling less anxious. So of course you will have some outliers out there like, nope, that's too much for me. I can't do it. That's fine. Then just be aware of your baby's movements. That's fine. Then you have people like me who I'm like, I'll do all the things. Give me all the apps, give me all the papers. I'll read it all. You have to figure that out with your patient and think through that. But just know that this does not increase anxiety in your patients. 9 times out of 10, it should not. And then, of course, we talked about this earlier, the stillbirth maternal mortality morbidity. To highlight this and dive this further into this even more, we published a white paper a couple of years ago that really does address this even further, and it shares real stories of women who almost lost their life or could have died, I guess, had they not been tracking their fetal movement and spoke up when they did. So again, all on our evidence page. And then some of the other proven benefits that Sam highlighted earlier was, could you identify pregnancy complications that threaten a mother's life? Again, white paper, read it. Increased gestational age. Our CEO is a perfect example of this. She went into triage around 31 weeks with reduced fetal movement. Turns out she was in active labor. She had to be on bed rest for just a little bit, then got sent home. They gave her procardia. And she delivered a healthy baby boy at 40 weeks. And so then are we also reducing NICU stays? So there's just a lot of moving pieces around this beyond, what we originally started this conversation at of the 21,000 babies lost every year. So do we have an opportunity of replicating our 32% reduction in every single state? We could save around 7,500 babies from preventable stillbirth. And some of the babies saved in Nebraska are right here. So again, these are stories that people have reached out to us and said, I was using your app, or I knew about you from my nurse or doctor, however they found out about it. They contacted us and shared their story. So we have over 150 baby safe stories that we know about. We know there's loads more out there, but this is just some. You have Chloe, Rory, Lilia, and Ellis and Everly. And I just love the name Ellis. Whew, that was a lot, right? And we're not done yet, but don't worry, I'm gonna get you out on time. So now is really the exciting part for me and probably Sam, because now we're really gonna talk about how do you standardize this? You've heard me talk about why we should do it and the research, and now you're like, yep, I understand. I get the research. I'm gonna implement this, but how do I do that? It's super simple. We're going to go through some tools for you, and then we're going to really do a step-by-step process here. Well, the first things first is how do you even talk about count the kicks, and how do you talk about fetal movement? When should you talk about fetal movement? So really starting in the third trimester. Now, I do get some questions where it says, well, should I bring it up in the second trimester? Sure. I don't think it hurts anything. And really the, pathway that you'll see from A1 will dive into kind of processes for first, second, and third. But I think what's important here and for our work is that you want to be talking about fetal movement monitoring every single time in the third trimester, every single time you have a touch point with your patient. And this does not have to take long. This should not take long. This takes 2 to 3 minutes. I know you have what, a 10-minute window sometimes with your patients, 1 to 2 minutes about this. That's it. So starting in the third trimester, 26 weeks if they're considered high risk or have multiples, just say, hey, I want to talk to you about your baby's movements. Now's the time that you should be tracking your baby's movements. There's a lot of cool tools out there. Here's the one I want to talk to you about. Here's Count the Kicks. Hopefully you have brochures or posters in your waiting room that are for free. But here, I want you to download this app. Just scan this QR code on the brochures and download the app. It's completely free. If they don't want to download the app, there's paper kick counting charts, but the whole process is the same. I want you to track your baby's movements every day in the third trimester. I want you to get to know what's normal for your baby in the third trimester. So every single day, you're going to sit down, you're going to find a time around the same time each day. When do you think baby's most active? Is it evening? Is it morning? Or is it just you only have time to do this at 10 o'clock at night when you're laying in bed because you're so busy throughout the day? Whatever time it is, choose around the same time each day. Sit down, focus on baby, lie on your left side, and just open your app or get your paper and your timer ready. And when you're ready to start, when you feel a movement, go ahead and start the timer on the app or on your paper, whatever you're tracking, and tap the footprint on the app or mark it on your paper every time you feel baby move, roll, push, swish. Anything except hiccups. I don't want you to count your hiccups because hiccups are involuntary. They're like breathing. We'll talk about what hiccups are in a minute. I'm pretending like you're my patient if you didn't catch on. So you sit down, you focus on your baby, tap the footprint if you're using the app. And then what's really cool about the app is it stops after you get to 10 movements and the timer will stop. So you are getting to know what's normal for your baby and how long it takes your baby to get to 10 movements. So after you stop on the app will ask you to rate the strength of those babies, because I also want you to be paying attention to the strength of those babies, of your baby. I want you to chart that between 1 through 5, fluttery to fierce, and mark that. And then I want you to add notes if you want. It's kind of like your mini diary for baby. You can add notes right there that you can send to me later. Then what's my favorite part of the app is it gives you a graph. So you see visually how long it takes your baby to get to 10 movements, the average amount of time it takes your baby to get to 10 movements on the graph. You also can chart it on a paper chart, but let's talk about the app here. So anyways, they see this graph and then they can download the data. They can put it in a MyChart. They can share it with you when they come into triage. So you as a provider can take that, you can listen to them, and you can do that shared decision making that we talked about a little earlier. So after a couple of days, they start to see that trend. This is completely free. This is what it looks like if you haven't ever downloaded it. I have really exciting news. Y'all are like the first to know. We will be pushing out updates here on the app that I think you're going to love. I can't say anything just yet. But check the app in 24 to 48 hours. If you don't have manual updates on, go update in the App Store if it tells you. There's some really cool features I think you're going to love. One will be another tool for your patients to use to get research-based answers. I'm kind of saying more than I should, but you can figure that out on your own. There's also going to be kind of a different, this clock will look the same and the start counting will look the same, but the menus going to the bottom, it's just going to be a lot more user-friendly. They can add a profile image, so they could add a picture of their ultrasound or their family. It's just, the changes are phenomenal. And then later this year, since I have you here, I can tell you, probably at the end of October, we'll push out another update that will have a contraction timer, because that has been something that app users have been asking for, as well as providers saying, I wish I had one app that had both. So we're adding a contraction timer as well. So check for that at the end of October. And then we're also adding, it's called OCR. So that's like optimal characterization. Basically, if you have people using our paper kit counting charts, they will be able to scan their chart and upload it into the app, and it will update their graph. So it's like a manual entry. We get questions all the time. For those of you that are seeing rural patients that might have broadband Wi-Fi access and they have to use paper charts, or maybe you just have mom that likes to do kind of old school paper charts, have them download our paper charts that are free on our website in multiple languages, and then they'll be able to scan their data and upload it into it. So then they can still give you the graph later when they get to Wi-Fi, or they can go to a library or a friend's house. It's just another tool that we'll be adding. So Sam, I'll be sure to email you when the app is live. Maybe you can send it out to everybody, because it's going to be really cool. I think you guys are going to like it. But going back to the app currently, it's completely free. It's in 21 languages. This is exactly what it looks like. This feature won't change here at all, so people will remember that. And then you can download. We don't share or sell our app user data either. We also try to connect people to free and reduced cost resources. This is on the resources tab of the app. This also won't change. Instead, it's turning into like a My Zone, it's called. And that's kind of more like a Facebook feed. You'll be able to scroll down and it will have resources, testimonials, feedback, all that fun stuff that's already on the app, just kind of in a different layout. But the resources will still say you can search by zip code. So if you need to find a local diaper bank or something like that, you could enter your zip code, or your patient could enter their zip code and find that here on our app or on that website too. And then how do you have this conversation? Well, we have the tools to start the conversation for you. The easiest way is to hand them a brochure and say, hey, have you ever heard about this program? I want to talk to you about this. And so with our partnership with the Nebraska PQC, you can order all the materials for free. You just scan that QR code or go to counttthekicks.org. I'm sure Sam's going to put that in the chat, because she's awesome and she does all that for me when I'm having these presentations. You have them in English and Spanish, the brochures and posters in Nebraska. And because of this work that we've been doing with Sam and Marissa and the health systems there, they really talk to me and Sydney at the PQC, because we have another tool called our Badge Buddies and Reels. And these are just little, kind of like your ID card that has almost like a cheat sheet for the conversation of Count the Kicks, and then a QR code on the other side that goes directly to the App Store. So you can just have it to your badge and you can say, here, scan this right here. So those are completely free on our website. So go place an order today. We get the emails when the orders come through. So hopefully you're going to do that. And I'll get off this webinar and be like, oh my gosh, 15 people placed orders. That's awesome. So those are just some of the tools to have that conversation. So in about 2 minutes, we're going to talk about the step-by-step process of implementation and just give you some ideas of what that could look like. But first, I wanted to address some of the misconceptions, and feel free to put more questions in the chat. What do you hear around fetal movement that you want me to address? I'm happy to talk through any of those. These are kind of the most common ones we get. My baby should get 10 kicks in 2 hours. Again, this is outdated. What we really want is to let people know every baby's different, every pregnancy is different. The recommendation to get 10 and 2 is outdated. What we want to do is make sure you know what's normal for your baby. There's research on our website about why 10 and 2 is outdated. Basically, what it says is, as humans, individuals, we focus so much on time. And so, like me, I know this is for an hour. It's 8:10. I have about 20 minutes left. So I'm looking at that. So when we focus so much on that and we have somebody counting, and let's say for the last 2 weeks, they've been counting and they're getting their baby movement around 15, 20 minutes every single day around the same time. Like that's been their normal. And one day they're counting and they got their baby's movements tracked and it took like an hour and 47 minutes or an hour and a half. And so that's significant, right? That's different than the 15, 20 minutes that they had been doing for the last 2 weeks. But in their mind, since all they've heard is 10 and 2, or sometimes 10 and 1, I've also heard, they think they're fine and their baby's fine because it still has been before the 2 hour mark. But really, they should go to get checked out, right? They should call. You should do that shared decision making, talk to them about their data, go into their nearest birthing center and get checked out because that's a significant change. That's what we want. We want them to get to know it's normal for their baby. And then the other common question I get quite a bit is if baby's not moving, I should drink something cold or eat something sugary to get baby moving. Or I've heard, drink a Mountain Dew, eat a Snickers bar type of thing. And so again, we don't want interventions to get baby to move. If baby's not moving like normal, and that's the key, right? If they've been tracking and they know what's normal for their baby and their baby's not moving like normal, why are we trying to force baby to move? So it's just like when you and I are sick, we are conserving our energy. Same with baby in utero. If they're sick or something else is going on, infection, umbilical cord, whatever, they're conserving their energy. So why are we trying to force baby to move if they're not moving? And why are we questioning it anyways? Just come in, get checked out. So those are some of the common myths. If you have other ones, I'm happy to address some if you want to throw them in the chat, that's fine. So now I want to kind of flip the script a little bit and talk about what you're all here for, probably the system implementation part of it. So hopefully you all knew about Count the Kicks and maybe you learned something new and feel a little bit more confident in your conversations with your patients. Again, I think one big takeaway from that first part was to know that we should be talking to patients about this, and it's okay to talk to patients about stillbirth. Wouldn't you rather know all the different things that you could address when you're pregnant versus, oh, I don't want to tell them because that might make them feel anxious. First of all, that's patriarchal, right? Like, why are we assuming they don't want to know because we think they'll be scared? Like, give people the benefit of the doubt. Don't treat people like flowers. So now that we're onto the system implementation side, so hopefully you feel confident in this. We're going to dive into kind of the step-by-step process of that. And I just wanted to highlight some providers. Dr. Monsager is on our medical advisory board, and your own Nebraska, Dr. Ann Anderson-Berry is also on our medical advisory board. She's also with the PQC as well, phenomenal individual. So both support fetal movement monitoring and Count the Kicks. There's some quotes here that I wanted to highlight for you that you can read, but I just wanted to show you that it's more than just me as a public health person in the field that's doing this day in and day out saying they support this. So step one, we're going to educate patients early. So like I said, you can introduce this concept of fetal movement in the second trimester. Absolutely. Heck, you can do it in the first trimester, but I want you to do it every single time in the third trimester. So I have an example of this. I had a patient, or I don't have a patient, sorry. I had an individual who had a stillbirth who called me when I first started, and she lived over in Eastern Iowa, and she said, I knew about you because there was a brochure in my binder that they hand me at my first 10-week appointment when I go in, and it was split into trimesters. And I remember seeing it, but I remember thinking, oh, I'll get to that when I get to the third trimester. And then as pregnancy went along, you kind of look at that binder, at least in my experience, first thing, you're going to see all the stuff. And then you go along and you get busy and you put it on a shelf and forget it. So she never saw that brochure again or anything like that. And that was it. That was how she knew about Count the Kicks. It was a brochure and a binder that she received at her 10-week appointment, which is great. I'm glad the brochure was in there. What wasn't so great was the fact that it was never addressed again. So address this in every trimester if you want. Say, we're going to be talking about this in the third trimester. I want you to be aware of it. When they're 24 weeks, say, hey, I want you to download this app to prepare for this conversation in the third trimester. When they're at their glucose test, say, it's time to download the app. Just things like that. And then you're going to provide all the educational materials. This is your tool to have this conversation, because I know it's hard to talk about. I know it's hard to say, hey, did you know you can maybe prevent preventable stillbirth? Like, no, you wouldn't say that to a patient. You'd say, hey, here's this great program. I want to talk to you about how you can feel empowered and track your baby's movements in a fun way. That's all you need to say. And then talk them through what we did earlier. And then emphasizing the importance of tracking fetal movements to help detect warning signs, because you will get patients who will say, oh my gosh, my baby's always active. It's like a jungle gym in there. Or you will be working with providers who say to patients, you don't need to count because your baby's always active. I have heard that multiple times from people who have had losses, and it just blows my mind that people are still saying that. Even active babies can experience a reduction and a change. And sometimes it's really fast without warning. Track your baby's movements. I don't care if it's like a jungle gym in there, track your baby's movements. And then you're going to promote the app. You're going to share the app or our paper kit counting charts. Again, we have a lot of great tools at your disposal on our website. Encourage them to download the app. Download it while I'm talking so you know how to use it, and then update it again when another day. But you should know how to use this app. You should be able to take out, if you have an iPad or your phone or whatever technology you use, and say, hey, look how easy this is. You just tap this footprint every time you feel baby move. I want you to pick a time. There's resources, there's FAQs, and then train your entire team. So there's about 15 of you on the call today. Go back and talk to your team about this. Hey, have you heard about Count the Kicks? And I guarantee they're all going to be like, yeah, I know about it. And be like, no, did you know about Count the Kicks? Like, do you know how to talk about it? Like, have we had this conversation with patients? Like, push it back on people and highlight the app's benefits, such as that personalized tracking, the early detection of movement changes, takes the guesswork out of knowing if your normally active baby has slowed down because they have graph, they have data in their hands. Talk about how empowering it feels to know and get that. And then how about we incorporate it into your incorporate fetal movement into your routine care. So I keep saying this, I feel like a broken record, like discuss every single time you see your patient in the third trimester, because I cannot get it. I just cannot say it enough because we hear these stories, and we hear stories of losses who it's their second or third or fourth pregnancy, and they are never told about fetal movement, and they noticed a reduction, and they said, why wasn't I told? I've been, just because I'm a fourth time parent doesn't mean I should know all of this stuff. Like, why wasn't I told? We want to turn that why wasn't I told to I'm so glad I knew. I'm so glad somebody took 2 minutes to educate me on this, and now my baby's here because of it. Add this as a standard topic during your well-being assessments. My pie in the sky, and I think Sam knows this, like, first, my pie in the sky was to work with A1 and create this pathway that you're going to learn more about later this year. My second pie in the sky is integrating this into your EHR, where can you literally add a question that says, talked about fetal movements. You don't even have to say count the kicks. Just as a reminder, as a flag for you saying, yep, I did it. Hopefully you legit did, and you're not just marking a sheet. But at least that's another checkpoint for you. That is my pie in the sky, that we can integrate some of this into your EMRs, EHRs. And so let me know if you work in a health system in an area that you do have the ability to do that. I worked with Brian to update their Baby 360 app, where they have a section on fetal movement. I worked with National Baby 360 to update a handout that they had because they even had outdated information. So now Baby 360, Sam, correct me if I'm wrong, for Brian, has evidence-based information on fetal movement and then a link to the app store. Is that right, Sam? Or our web
You got
counter?
it. Nope. Yep, they
Yeah.
updated it. Yep.
Super easy. So depending on your health system, if you have some sort of patient, I don't even know what that would be called, patient portal resource, whatever, let me know. Chances are I've worked with them before, and I can easily update their verbiage, and you can too. Like, Brian had the ability to do that themselves. So, and then utilize patient feedback from the app to prompt a deeper conversation. So again, it's not, have you felt baby move yet? Yes or no? Let's have this discussion. What do you notice about your baby's movements? What questions do you have about your baby's movements? I live in Iowa, where we've had this 32% reduction. I have been so fortunate. I have had 4 pregnancies, one was a D&C miscarriage, 3 healthy living children. And I was not once talked to about Count the Kicks, and I live here. And my babies were all born within the last, 11 years is my oldest. I saw a poster on a wall, and that is why I knew it was important to track my baby's movements. So don't think that not putting something up, like just that helps. I want these patients to see it in their waiting rooms. What helps even more is you talking to them about it. What helps even more is them seeing it in their community. What helps even more is hearing these testimonials. So let them know you're here for them. All I was ever asked about fetal movement was at 21 weeks. Have I felt baby move yet? It was first time parent, first time mom. And I was like, I don't know. Have I felt? Because you don't know. Like, I don't know what those movements felt like. Is it gas? Is it, what is it? So that was it. So don't do that. Have these conversations with your patients. They deserve it. They deserve to have this type of conversation with you. And then again, pie in the sky, leverage technology to do follow-ups. Can you integrate Count the Kicks reminders into your clinic's patient portals or text systems? I do have a couple health systems that I'm looking at right now who are looking at this, where they can send out notifications when people hit the 3rd trimester in their portal. Can you do that? Sometimes it's a super simple way to do that. You just need to get the IT folks on the call, and then they're like, yep, super easy. Use the tools that you already have, automate those messages as much as you can. Collaborate with your community partners. I know the importance of a health system in a rural community. I know how much you are seeing. I grew up in a small town. I know that you're getting people from all over in those rural areas. And then in those more metro areas, I know that you have access to a lot of great organizations and a lot of great resources. Work with them, work with your local health departments and say, hey, here's materials. I want you to order these, or I'm having this presentation, come do this or watch this recording. We have a lot of great resources on our website. So don't underestimate who you know, that 6 degrees Kevin Bacon type thing. Talk to them, talk to people in your community, participate in local or state initiatives to improve birth outcomes with this tool. I'm actually, oh, I should send it. On October 1st, I am hosting a listening session with University of Iowa researchers for an NIH grant to talk about what you want to, what you see and what you need from a health system level for stillbirth prevention. Like what are you seeing? What would make it easier for you? I'm not talking just fetal movement, just in general around stillbirth. So this listening session is on October 1st at 11 o'clock. I'll send it actually in my follow-up. And what we're going to do is it's just 1 hour. We're going to have breakouts. So I want community members in a breakout and lived experience. And then I want providers, those that are working day in and day out with these patients, in a breakout. And we're going to ask really specific questions and have an open discussion and then come back. And this is going to help develop our aims for this grant. So absolutely join if you can and share it with your providers and anybody else on your team. And then partner with those rural healthcare providers to ensure people have access to your resources. And then here are the tangibles that you can use for implementation. We already talked about the materials, the posters, the brochures, the badge cards. We have gold standard after visit summary documentation I can send you if you're interested in going and implementing this into like your triage paperwork. Mary Greeley did this and we use this with their approval, but we have other health systems who have taken that and implemented it into their triage. We have a 4 CE training. It's $80, but I'll send a link as well in my follow-up email. And then some states and some locations will order these bands, these fetal movement bands. If you're in a rural area, these would be really good for access. Basically, you can't see it here, but there's numbers 1 through 10 on it. And then we have a how-to card in English and Spanish that goes with them. And so it's just another way patients can count. So if you're interested in ordering any of those, let me know too. And then this is really cool. And this is brand new. So anyone that joined the July webinar missed all this, Sam. So we're going to have to send this back out to them. But that piece you saw earlier of that how to count method, we get asked all the time for something like that. And we can't send you our brochures PDF because of copyright. So what we did is basically took it and turned it into this easy snapshot where you can share with your patients electronically. Because sometimes we get questions say, I wish I could just share this in email. And so down on our website and our how to count section, we have this where you can share just by clicking the more button. You can email it. You can send the link out, that type of thing. If you want to do a step further and really integrate it and embed it, come talk to me, because then we have licensing fees, but it's really not a crazy amount. It's just to make sure that we're following and making sure that the copyright's being done for the embedding type of thing. But you can share it for free. Like, you can share the link out and this specific piece in all of these languages. So again, this is another tool for you. And then just kind of summary, other integration is, of course, order the materials, embed digital resources. We have a Count the Kicks champion program too, where it's kind of like train the trainer. If you want to know, if you work in a community or you have coalitions, you can become champions with this program, where then they get digital resources, PowerPoints to share with parents. So that's an option. Can I come to your grand rounds? Can I talk about it here? That could be like a 15-minute presentation. And then again, our online CE training as well. And this is, I'm going to end with Shannon and her why. She couldn't be here today, but she did email me and wanted me to say hi to you all. But this is her why, and a little bit more about Alfie.
Being a Count the Kicks ambassador is important to me because it is a way that I can continue to parent Alfie. He's not here with me, and so it's my parenting technique for him. I raise awareness in Nebraska by partnering with different community organizations. I raised awareness by working with OB offices and just through sharing the information in general with my community and communities across the state. My vision for stillbirth prevention in the U.S. is that it will eventually be in every OB office across the United States, and every expectant parent will use Count the Kicks as part of their regular prenatal care.
She's really passionate about coming and doing this in a clinical setting. So definitely reach out if you have any questions around that. And then here's information on how to get your CEs. So the CEs will not come from me. Sam, do you want to share a little bit more about this process?
Yes, absolutely. So all you guys have to do is either can't click on the link, but if you type that SurveyMonkey in or you scan the QR code, we will send you out the CE within the next 7 to 10 business days. And it's very easy. It should be quick to go, and then you'll get the 1.0 CE. So this is our last of the two that we were doing. But if you guys feel like in your clinics or in your hospitals you would like more education or resources or Megan to talk, like, we can definitely get that. We have great collaboration and we can get that set up for you. So we really, really, really appreciate you guys spending the time today. Share this information with your clinics, with your hospitals, implementation around the cities. It definitely is a public health crisis that we can manage. So
yeah, I know that says July 23rd because that's when the other one was, but this link works for them too, right? This is
yeah, it's the same link. Yep.
Okay, so I will also put this link in the email that you get, so you can easily just click it and go to the evals. And then Sam, you will send out the CE certificate once they get the evals. So I get questions a lot about this, like, because I presented, but really it's going to go to Sam. So I'll add her contact information too in the email. So if you have questions around the CEs, just contact her. Otherwise, you can contact me, but I'm going to forward you to Sam. So it's like not the end of the world. And then, yeah, I did 2 minutes to spare. So if you have questions, feel free to stay on, put them in the chat. As you're automatically muted, you can raise your hand and I can unmute you. But just thank you to Brian and St. Elizabeth and, the A1 and the PQC. I love labor and delivery nurses. I love what you do. I'm just so thankful for what you do. And I hope this morning, has woke you up a smidge with these beautiful baby faces, and that you can go about your day with a smile on your face now having these in your toolbox. So I'll end there, Sam. And I feel free to ask questions, or you're free to go with 1 minute to spare.
Thank you so much, Megan.
Thank you. I am going to stop.